without any further ado, we will get moving forward with our agenda for today. We're very excited to have with us two wonderful public servants. I'm going to introduce them in a minute, as well as Melissa Lynch, who's the ambassador for Long COVID Kids USA. And Melissa is going to be sharing some information with us today as well. And then we'll be having a brief legislative update from our policy director, Tiffany Gladney. And as always, we'll end with any announcements there are and we'll adjourn. So I hope that everyone has an opportunity to have a wonderful weekend coming up, enjoy this nice weather, maybe think reflectively on where we are, both currently and where we were 20 years ago. I may not remember where I was 20 years ago today, but I certainly remember where I was 20 years ago tomorrow. And so I think it'll be an interesting weekend for all of us. And I know for myself, continue to send our heartfelt thanks to all of those who tried to help us recover from the September 11th terrorist attacks and that disaster 20 years ago, and currently are serving our communities in so many ways today. So I really excited to share with you all quick introductions. We have our public health infrastructure is a powerful force that benefits all of us daily, but that we sort of take for granted at times because their work can be kind of behind the scenes. But public health staff have been the backbone of our COVID-19 response over the last 18 months. And today we're going to hear from two folks on the front lines of that response about how COVID-19 impacts children. I'll introduce our first two speakers and then we'll quickly get into it because their time's very limited. Dr. Zack Moore is North Carolina State Epidemiologist and the Section Chief of Epidemiology at the North Carolina Division of Public Health. And Dr. Kelly Kimple is a pediatrician and the Section Chief for Women's and Children's Health at the North Carolina Division of Public Health. Thank you to both of you for your tireless work throughout the pandemic and for taking some of your time to be here and share your insights with us today. So I am going to go ahead and get started, and I will turn it over to you, Dr. Moore.
Okay, thank you. Can you hear me okay? And it looks like it's telling me the host has disabled screen sharing. Can we get that?
Yep, I can fix that for you. Hang on just a second.
Okay, thank you. So anyway, while we're doing that, thank you so much for the invitation to talk with you all. And I feel the need to share that I'm also a pediatrician, just with this group in particular. Oh, here we go. We got this all set. So I'm especially pleased to be able to be with this group focused on the health of our children. And I think we're making progress. Can somebody verbally let me know that they can see the slides?
Yep, we can see them. Looks good.
Okay, thank you. All right. Well, as technical difficulties go, that was mild. So I'm just going to give a quick overview of where we are with the pandemic right now in North Carolina, and particularly as relates to children. And then I'm going to turn it over to Dr. Kimple to talk more in detail about vaccinations and mental health issues and some of the other concerns beyond just what's happening with the virus itself. So I've got a slide here that shows metrics that I imagine are mostly familiar to people by now. These are 4 of the key metrics that we've been tracking. We have lots of ways of tracking, but these ones have been highlighted by Secretary Cohen in her press briefings. And so just wanted to start here. If you look at the upper left-hand corner, that is the number of people currently hospitalized each day with COVID in North Carolina. So this is probably the most concerning number on this slide because we've got really high rates of hospitalizations, and I'll talk about kids specifically in a minute, but we, as you're very well aware, having big capacity issues, particularly in terms of intensive care, which I'm not showing here, but we've been over 4,000 people in intensive care with COVID now for more than a week. So this is really stretching our system And this is exactly what we've been working to avoid. There has been a slowdown, which is reassuring. We're only seeing sort of marginal increases, but that's probably, like I said, the most concerning. And then on the top right, that's when we look at the PCR tests that are coming in to the state. This is the percent of those tests that are coming back positive after looking at all tests. So that's been hovering over 10% for quite a while since the surge with the more infectious Delta variant. We had been down actually below 2% in June before we started climbing back up with Delta. So this is just indicative that there is a very high level of virus circulating out there in the community. And then sort of going clockwise, the red line down there, we look at not just reported cases of COVID, but we look at some other metrics, including who's coming to emergency departments for COVID-like illness with or without a test that meets criteria for a COVID-like syndrome. And what we've seen there is that percentage of visits really went up with this Delta surge to levels very close to what we saw back in December and January, but that's also started to level off, not drop down, but level off. So that's some reason for optimism. And then lastly, on the bottom left, this is the number of daily cases that are reported to us in public health. And you can see this is actually yesterday's data, but we're up, well over a tenth of our whole population, close to 1.3 million cases that have been reported to us cumulatively. And if you look, this is over time, you can see the dates on the bottom. Where we are now with the numbers of cases is pretty close to where we were back in our largest peak in December and January of last year. So I wanted to break that down a little bit in terms of that last graph and the number of cases, looking at ages particularly. And I think what's most notable here is if you look at the yellow line, this is not the number, but the rate of cases in children. So the number of cases per 100,000 children or whatever age group. And you can see that rate of cases in children has gone up very steeply with this Delta surge and far surpassed and really, I guess, doubled what we ever saw during the December, January winter peak. And over this past week, we did start to see some decrease or leveling in all other age groups, but the rates in children have continued to climb sharply. Okay, and then this is, again, I talked about percent of tests that are positive. We break that down looking just at those tests that are being done in kids by specific age group. And what you can see is that it's really the purple, which is our sort of high school age, and green, which is our middle school age, where we're seeing the highest positivity. We're also seeing the highest rates of infections in those age groups compared to our elementary and sort of infant and preschool ages. So that's where a lot of this transmission and these rates are being driven by infections in our middle and high school kids. So it's not just cases, we're very, I guess I should say, fortunate that COVID generally is milder in children than in older people, which is good news. But with this big increase in the number of pediatric cases, we are seeing, as expected, a big increase in the number of hospitalizations. So on a per infection basis, doesn't seem any more likely to be that hospitalizations are not any more likely now than they were in the winter. But with so many more kids being infected, we've seen a tenfold increase in hospitalizations in younger children, 0 to 4. And then looking at adolescents specifically, we've seen that unvaccinated adolescents have a 10 times higher rate of hospitalization than those who are fully vaccinated. And this is data that's from an MMWR CDC publication last week. And then just zooming in a little bit on the southeastern United States, we have had in this region the highest rates of hospitalizations in children. This slide is showing the rate of hospitalization in all children 0 to 17 years of age. And you can see that rate per population is far higher than it ever was in the Southeast during the winter. So very concerning that although most of those cases in children will be mild, we are seeing a lot more hospitalizations. And then we do have other things we worry about with kids specifically. There's something called multi-system inflammatory syndrome in children, or MISC. That's something that can happen shortly after, or even several weeks after a COVID infection, when kids can develop inflammation in several organ systems and can be very severe. So we saw a lot of those cases during the winter surge. We're not really seeing that yet with our super high rates in kids, and that's encouraging, but it does lag. Sometimes these cases don't happen for 2, 3, even 4 weeks after the initial COVID infection. So watching that very closely. And I'm pleased that there's someone on to speak about long COVID or long symptoms, and how that's another concern that we have with kids, aside from what happens during the acute infection. Okay, just quickly stopping on the age groups, just to make sure everyone's aware that we're still seeing disparities both by race and ethnicity, as we have since the beginning of the pandemic. This shows rates by race, and you can see the blue line, which is our American Indian population, and the green line, which is our African American population, have tended to be higher than rates in the white population in purple, or the Asian population in red. And that's something that we're seeing with Delta as well. And then when we look at ethnicity, and this applies to children too, we see a lot of the same patterns. We're seeing higher rates, and always have, in people who are Hispanic ethnicity. That's that top purple line, compared to rates in non-Hispanic people, which is the blue line. So just always important for us to keep those disparities in mind, that not everyone is affected equally. Okay, and my last slide, and I think I've talked too long, just to point out, and I'm sorry I don't have the link, but this is from our dashboard in our CLI report, our respiratory surveillance report that we update every week. We are seeing clear evidence in our own state data of the impact vaccines are having, specifically when we look at the rate of infections, which is on the left, in people who are not fully vaccinated. That's the dark blue line, compared to people who are fully vaccinated. We can see that the rate of new infections is, for the most recent time period, 4 times higher in people who are unvaccinated than those, and people who are not fully vaccinated, than those who are. And it's even more stark when we look at deaths on the right. The rate of COVID deaths per population in the people who are not fully vaccinated is this dark blue line, and then vaccinated is this orange line. And these numbers fluctuate, but it's running about 15 times higher rates of death in the unvaccinated compared to people who are vaccinated, after accounting for age. So, nothing that we didn't know, but the way we're tracking it in our own data. And with that, Kelly, I think I'll toss it over to you, and you can just tell me when you want to move on to the next slide.
Of course, and thanks for being willing to keep flipping through the slides. So great to be with all of you child advocates today. To that point, as one of our, prevention strategies with COVID-19, in addition to masking, vaccination has been key. And I do want to emphasize that vaccination continues to be effective, even with the Delta variant circulating. That is very effective, especially against severe illness, hospitalizations, and death, as Dr. Moore just showed. So this slide just gives you a little bit of an overview of where we are in North Carolina with our vaccination rates. And so you can see by age that we actually already have 64% of our 12 years and older individuals who have received at least 1 dose of vaccine. And so on the right there, you can kind of see the different colored bars, where the 12 to 17 age range, that orange, really expanded once we expanded to the 12 years and older, as opposed to just 16 and 17-year-olds who could initially get Pfizer once that was initially rolled out. And so you can see that our adolescents are a larger part of the vaccination that we're accomplishing, and hoping to continue to get more of our adolescents vaccinated. As of right now, you all may be aware, but those under 12 years of age are not currently eligible for vaccination, although working to get there. You go to the next slide. And so this also just breaks things down by race and ethnicity. Like infection, like these cases, also see We have some work to do with our vaccination rates. While we've made some progress, we continue to try to put equity at the forefront, especially with our operational planning and seeing what we can do. But this breaks down the percent of at least one dose by race and as well as ethnicity. So there has been some improvement over time, but more work that we're focused on doing as we move forward with vaccination. Next slide. All right, so you all probably have seen maybe in the news that FDA extended full approval to Pfizer vaccine for ages 16 and up, and then it was recommended by the Advisory Committee on Immunization Practices. Following that, it is marketed as Comirnaty. It is not something that rolls off my tongue. I'm trying to get used to it, but it is a combination of COVID, mRNA, and community is what I've been told. And so this is for prevention of COVID-19 for 16 years of the age and older. The 12 to 15 years expansion came a little bit later. So because of that time lag and the need to have that additional time before full approval, that continues to be available under emergency use authorization. Same with those that may be eligible at least for an additional dose due to being moderately or severely immunocompromised. That also remains available to 12 and up under emergency use authorization. They're also using the same fact sheets, and some of you may know the vaccine information sheets and all that stuff, but they're just using one fact sheet until we have approval for all these COVID vaccines. Next slide. Another change that came somewhat recently was in our minors consent law. And so we had, it was on August 20th, that new law passed that required healthcare providers to obtain written consent from a parent or legal guardian of a minor prior to administration of any vaccine granted emergency use authorization and not fully approved. So, and then I believe it was the following Monday where we had approval of Pfizer vaccine for the 16 and 17 years of old. So this does not change any of the other minor consent laws. It's purely related to vaccines under emergency use authorization, but this does impact some of the workflow processes and the consent that is needed for individuals to receive, for adolescents to receive the COVID vaccine. So, those adolescents 12 to 15 years of old do require written consent from a parent or legal guardian. The 16 and 17-year-olds kind of revert back to our minors consent laws, typically where we expect, and many times there are conversations related with the parents and the guardians around COVID-19 vaccine with the provider, but that they can consent if needed, if they show the decisional capacity to do so. Same with because the additional dose for immunocompromised under emergency use authorization, that also requires written consent for 12 to 17 years old. As you may be aware, Moderna and the Johnson & Johnson vaccines are not currently authorized for individuals under 18, and no one at this point, unless they're part of a clinical trial, under 12 is able to receive COVID-19 vaccine. Next slide. This is just some of the materials related to vaccines in teens. There's a nice new website to kind of, that was input from teens around teen vax facts to both in English and Spanish that is available, as well as from a provider perspective, some additional resources that we can get you all there. Next slide. And this is just a little summary of where things are with regards to moving forward with the additional age ranges. So there are trials underway and looking at 5 to 11-year-olds for Pfizer and Moderna. We still are waiting for any kind of expansion of the EUA with regards to Moderna for younger adolescents. And so, I think we all are looking forward, especially with school back in session, FDA to authorize COVID-19 vaccines for children under 12 as soon as possible, but of course going through all the safety mechanisms that they do so. Next slide. And a lot in the news around boosters. It's kind of been a lot of different things that have been said. We have received the date of September 20th as a planning assumption. We do know that on the 17th of this month, the FDA will meet to discuss the booster packet that was submitted by Pfizer, but only Pfizer is being considered at that point and not Moderna. And so we're not quite sure what the futures of boosters look like. I think initially it sounded more general with Pfizer and Moderna, with the general population, maybe 6 to 8 months following the initial series. Now it is sounding much more limited in the sense that it might be Pfizer. We're not sure if it'll be for a specific population. And so we're waiting to hear more and expect later this month to hear something around FDA authorization. And then, of course, the ACIP and CDC will weigh in on the recommendations for those boosters. Next slide. Another thing that impacts, I think, at least our provider engagement in providing COVID-19 vaccine is we've been using a system called the COVID Vaccine Management System. Some pediatricians and other kid serving providers are engaged in our Vaccines for Children program, and they're very used to entering vaccines into our North Carolina Immunization Registry. And so we really are trying to have the opportunity for providers to choose which system they are able to do, because we want this to be not a burden, an additional documentation burden. We want it to flow within that workflow in the office. And so really trying to find a way, especially during flu season, when somebody can get both COVID-19 vaccine and flu vaccine at the same visit if needed. It doesn't make sense for providers to have to document that separately. And so we're working hard to really give providers the option to see which system they want to use, and also expand the use, have all the COVID-19 vaccine records that we do have in our registry, and so that people have one consolidated vaccine record, which includes COVID-19 vaccine. Next slide. And this is a couple clicks, but just a quick reminder, we are in back to school mode. I know people feel it, whether it's from, the busy getting back into the swing of things, or maybe even some school quarantines or masking discussions in the community. We do have our immunization requirements that are back to as part of back to school. And so that's for non-COVID, our other routine vaccinations that are part of our North Carolina state law and our rules. Next slide. All right, so switching a little bit but from vaccines, but just a couple of quick updates for multiple things. With increasing cases in kids and schools back in session, we did want to just make sure you all are aware of the option for increased testing and staff in North Carolina schools. And so we're working to expand the screening testing program to support our schools, to protect our students and staff, and make sure that testing is available. And so we have school districts that are opting into this program and getting additional funding for staffing and testing that can perhaps provide some support at the local level to increase testing capacities in schools. Next slide. And, we could talk for hours on COVID-19 and mental health. And so I'm not going to go deep into this, but I did just want to provide, we are all concerned, I think, about the mental health impact of the pandemic, this longstanding pandemic, and the different effects that it has had on children and families, either directly or indirectly, and on different levels. Here, the next slide. Wanted to make sure, this slide first was just also depicting the ER visits for suicidal ideation and the self-injury before and during COVID-19 pandemic. And so this, I think, shows quite the difference when you look at that solid line at the top for 2021, and trying to and seeing how this is definitely impacting our kids and adolescents and with mental health concerns. Next slide. So as one of the ways in North Carolina trying to expand access to care, we do have our North Carolina Telehealth Partnership for Children and Adolescent Psychiatry Access again, not something that's rolling off my tongue today. This is a consultation and education program capable of providing mental health and telehealth support to primary care providers. And so really trying to make this this accessible so that those that may be encountering kids that may be struggling either with depression, anxiety, or other behavioral health conditions can have ready access to consultation, to kind of resources, additional resources, and to go through some of the next steps of what might help that child or family member. And so there's the psychiatry access line is there. Next slide. And there's been a lot of calls that consultation line has received, with a lot of pediatricians and also training pediatric providers with patient-centered mental health focus to have a mini fellowship of sorts in order to expand that mental health capacity among our primary care providers. Next slide. And then I just wanted to, as we know, our mothers and families are critical to our child health. And so from the maternal perspective, we have a similar program. You go to the next slide. I'm going through these a little quicker. This is our Maternal Mental Health Matters. And so there is a perinatal psychiatry line in addition to the child and adolescent psychiatry line. And that's to really expand access for our, especially postpartum or pregnant women that may be struggling with behavioral health conditions, postpartum depression, and those sorts of things. So there's a phone line for that as well from the perinatal perspective. Next slide. And this just gives you a little bit of update of the reach of that program as well. Next slide. And we have our Maternal Health Innovations Program, where one of the many initiatives as part of that is looking at community health worker doula efforts that are being piloted in 2 sites. And then we also have our 4th trimester project in collaboration with the CDC that launched the Hear Her campaign. I'm not sure if any of you are familiar with that, but this multimedia campaign just promotes the importance of listening to new mothers and making sure that this is part of our maternal mortality and morbidity initiatives, and also making sure that those that experience disproportionate and disparate outcomes are, that we make sure that they have a voice in their care and their outcomes. Next slide. Quickly on WIC, our clinics are beginning to welcome participants back in person. Some are doing hybrid. We have implemented two-way texting, so local WIC agencies can use that for appointment scheduling or reminders through our WIC system. And we also are doing a self-checkout pilot, which is taking place at 2 WIC County stores, and looking at the analysis through the end of August. Next slide. Through September of this month, we do have increased cash value benefits as part of the WIC program, which means that participants over 1 year of age are receiving $35 additional per month for the purchase of fruits and vegetables. And so as a result, we have seen an increase in the redemption of benefits. That being said, this is a limited benefit. I'd love for it to last longer, but as of right now, this is through September 30th of this month. Next slide. And I believe this is the last one. And this is just to let you all know our infant toddler program, which serves our birth to 3 infants and toddlers with developmental delays or disabilities, is, there was some back and forth with Medicaid transformation, but it is fully carved out of Medicaid transformation as of fairly recently, right before the launch, and will remain with Medicaid Direct. Before, it was the CDSAs, the Child Developmental Services Agencies, were carved out, but our contracted providers were carved in, which made it difficult, I think, from a programmatic perspective, with regards to who was in managed care and who was in Medicaid Direct. So I wanted to make sure that you all were aware of that, that change. We are also have the Medicaid flexibilities for the pandemic that have allowed us to do more statewide expansion of teletherapies. And we anticipate continuing those as long as that's available, but also trying to find ways how we can offer in-person services as as requested as needed, while maintaining, of course, safety for all of our kids and families as we move through the pandemic. So with that, I think that's the last slide, and we'll end there. If there are any questions.
Thanks so much, Dr. Moore and Dr. Kimple. And do you all have a few minutes for questions before we move on to Melissa?
Yeah, I can stay on.
Okay. Okay. So Fawn, I am wondering if we have seen any questions pop up in the chat.
Yeah, and before we jump to that, I wanted to ask Dr. Kimple and Dr. Moore quickly. One of the things we're seeing is maybe a lower rate, definitely a lower rate of vaccinations in that 12 to 17 age group. And just wondering if you all could address that for a second. Are there any additional safety concerns, side effects, anything like that that you think may be affecting parents' hesitancy or those lower rates? And is there any? What do you say to parents who are considering whether to vaccinate in that age group?
Yeah, so I think there's a lot of conversations are going on with parents and with their adolescents. I think the main message is that COVID vaccine is safe, effective, and we have been seeing, and I'm trying to remember the number off the top of my head, just millions of adolescents who have been vaccinated up to this point. I do know, and we have some on the website, and I think the link part of the PowerPoint that we can provide is there are those resources that address some of the common misconceptions around the vaccine. So for example, it doesn't cause fertility concerns. I think for a while there was the concern around myocarditis, which CDC has been monitoring, especially around adolescent vaccination. We were seeing this more often in our younger males that were receiving the vaccine. But again, this is, I think, showing that our safety monitoring works, because these are very rare, especially when you look at how many vaccines have been given. And they were also showing that most of these individuals that had myocarditis that occurred following vaccination, typically the second dose of a mRNA vaccine, that they would get better without treatment. And so this is something that we're continuing, all the safety mechanisms we're continuing to monitor, but it's very rare. They continue to be safe and effective. And when you look at especially myocarditis as part of COVID-19 infection, that also is something that occurs, and the risk or the benefits of the vaccine far outweigh the risk related to that because of all of myocarditis or other health risks as part of infection.
Similar to that, I think we wanted to ask if you all could address the same question with regards to pregnant women or women who are nursing. Are there any additional safety concerns, or, again, what's your advice for women in that situation, or moms?
Yeah, we continue to recommend, as well as, the OBGYN Society and the ACOG, the American Obstetric Gynecology group, continue to recommend vaccination for pregnant women. We're seeing, I think there have been concerns where pregnant women are at increased risk of severe complications with COVID-19. And so that vaccine is critically important to protect not only pregnant woman, baby, and family. We have some FAQs that are specifically related to that as well, which we'd be happy to share. But the recommendation is that pregnant breastfeeding women also get the COVID-19 vaccine to protect them as well as their community.
Thank you. Going to questions in the chat, there's a great question from Lori about communicating some of these things to folks on the ground. And so what is the strategy? What works well for connecting with folks who, have real questions and concerns?
There have been a wide variety of activities, and I know we are working closely with many partners at the local level, state level, and a lot of advocacy groups or groups that have connections with individuals and communities. And so I think this takes the form of, whether there's local, we've had like I was trying to think of the English, like our little charlas or some of the local discussions around vaccine or other issues that arise with COVID. We have our Healthier Together initiative, which really is bringing together people on the front line in communities and trying to reach, get these messages to not only everyone, but particularly our historically marginalized populations, but really leveraging information in areas where we might not typically find it. So yes, your primary care provider or your physician or somebody that can share this information, but how do we get it in schools? How do we get it in barbershops? How do we get it in the faith community? And those are some of the partners that we've been working with closely to try to expand the reach of the messaging and share these resources.
Great. And I think we can share some of the DHHS messaging toolkits in our follow-up email that we send out to folks today. And if folks haven't seen the teenvaxfacts.com, that's a great resource. I think that's what you were referring to earlier, Dr. Kimple. Question from Joanne Freeman. So what are the best strategies for prevention with kids under 12 who are too young to get vaccinated?
I can start, Kelly, if you want. But yeah, I think it's really, we keep talking about layered prevention strategies, and, I saw the question about vitamins, and of course, staying healthy and active and anything you can, do to put yourself in a good position is always important. But, especially for kids, first of all, to the extent that the people around them and in the community get vaccinated, that's number one. That's going to reduce their exposures. But then those other layers become even more important, and particularly masking, which has unfortunately become quite controversial, but there's, great evidence base for the effectiveness of masking in preventing kids from becoming sick with COVID. And then, there's, other layers that can be added on depending on the setting. We talked, Kelly, Dr. Kimple mentioned school testing and the options that we've made available there. So, introduction of routine screening into schools. And I saw a question also about childcare where that's not as routine, but to the extent that those types of systems are in place, that's another great way to pick up cases early and reduce exposure to kids who are too young to be vaccinated. So it's not ever one thing. It's really sort of about, especially when we're in this surge right now, layering those prevention measures. And then hopefully, as we start to see rates go down, the need for all those layers will be less acute.
Well, thank you so much, Dr. Kimple, Dr. Moore. We really, appreciate your time, your public service throughout this pandemic. And let's just give them a virtual round of applause right now. And thank you all for joining us for sure.
Thank you.
So
thank you, Will.
Yeah, you're welcome. So we would now like to move forward and hear from Melissa Lynch, who is doing some work around some of the unfortunate long-term effects of COVID on kids that really we're all just beginning to sort of learn more about and discover, I suppose. And so, Melissa, I'm just going to turn it over to you.
Thank you, Adam and Fawn. And first of all, I would like to say thank you, Dr. Kimple, and thank you, both of you, for everything that you do and have done for children across the board in this pandemic, and all healthcare providers, and of course, all advocates. We could not do this without each other. Long COVID kids is and I don't have any fancy slides right now, but Long COVID Kids is an international charity, and we span across 5 different countries. And you may be wondering what Long COVID is. Long COVID is where a child tends, after the initial infection, it may be asymptomatic, which shows no symptoms, or mild. They tend to have a recovery period of 1 to 2 weeks, and then they kick back in with symptoms. I am a mother of a 12-year-old. She is going past a year, and we continue to have symptoms. And she has seizures, and a lot of these children are coming out with autoimmune disorders like dysautonomia, POTS, PANS, PANDAS. According to the clock study that we collaborated with, 1 in 7 children that are exposed and test positive will end up with long COVID. The highest age range that is at highest risk for long COVID is 12 to 16. 80% of that will be female. And what Long COVID Kids USA does is we connect researchers, we connect families to research across the country. We collaborate. We partner with HHS, we partner with CDC, we partner with NIH. We are also listed on CDC as the top support group for children. We not only accept children with long COVID, but we accept children who have tested positive also recently due to the pediatric surge and the Delta going through. Our mission really is to educate, connect, support. We do lobby for changes within policies. We're getting ready to set up a patient advocacy group globally and draw out mitigations. We helped NIH do this within the United States and also CDC. But if you know anybody that may have long COVID, hop in. We're on Facebook, Twitter, Instagram, and we support about 20,000 children globally. Within the United States, on Facebook alone, I have about close to 500 families. And in order to be in the Facebook group, because it's a little more protected and private, you have to have a child with long COVID or a child that has tested positive. We are getting ready to do some more collaboration. We're going to be working within the United States with some others to get a child's long COVID database set up. We're looking at that right now and collaborating. And we have a school pack that's international that tells everything about long COVID, what it is. And we have a blog and a newsletter. And we believe that prevention is the main start in preventing long COVID, prevention of COVID. Enforcing, or not enforcing, but ensuring mitigation, proper education, educating healthcare providers and parents how to care for their children, with or without COVID. Let's all support, because I know it's a very long everything. It's very long and drawn out, and a lot of times the mental health, and I'm so glad to hear that North Carolina, because we've also worked with Duke, we work with UNC post-COVID care, and we work with Children's National out of Washington, DC. But I appreciate everything that everybody does. We're at longcovidkids.org. And thank you so much for having me on today.
Thank you, Melissa, for sharing. Again, that's longcovidkids.org, and we'll make sure and share that information. So thank you. I am now going to pass things over, and we're going to switch gears just a little bit as I move it along to our policy director, Tiffany Gladney, who is going to provide us with a legislative update for the week. So Tiffany, take it away.
Thanks, Adam. So for the sake of time, I'll keep this really short. So on Jones Street, we are still awaiting a conference report, but apparently there are some compromises being made. So stay tuned for that. Committee activity will also be wrapping up in the next few weeks. So there is a flurry of committee meetings happening right now and tons of bills that are moving this week and in the weeks ahead. Federally, there's also a lot going on. Of course, the Democrats in the House released more details for their Build Back Better Act, which is President Biden's proposal of 3.5 trillion social spending dollars, social spending package. So the House and Energy and Commerce Committee unveiled their plans to lower prescription drug prices, permanently expand Medicaid for non-expansion states under the Affordable Care Act, and invest in home-based care. The Education and Labor Committee released their plans to lower the cost of childcare and secure universal pre-K for 3 to 4-year-olds, strengthening public schools, expand child nutrition programs, and more. So we will have tons of resources for you in the written update this week. And also be sure to tune in next week. If you find yourself just wondering what the heck is going on in DC, what's going on the Hill, tune in. We'll be really diving into the details on what exactly is going on, and with all these packages and Build Back Better and all these infrastructure plans and all of that, we'll be diving into that. So be sure to tune in if you're curious. So with that, I'll turn it back over to Adam.
Thanks so much, Tiffany. It's just an interesting time at the state level, right? As we wait to see what's going to happen with the budget. So at this point, I'd just like to ask, does anyone have any announcements? Maybe you could even put something in the chat quickly if you want to share it with the group. Otherwise, as Fawn is showing us here, there is a couple of upcoming topics that we're going to be talking about in our upcoming meetings. And next week, it looks like we're going to be focusing on the federal package. As Tiffany had mentioned, there's a lot to discuss there with this Build Back Better plan. And all of that is really coming to a head over the next few weeks in Congress. It's going to be really fascinating to see how that plays out as well. And then on September 24th, we're going to be talking about local advocacy for school safety. What are some things that we as advocates, as parents, as community leaders can do to be strong advocates for having safe schools and utilizing the science and the recommendations there? So those are a couple upcoming topics that we have. And of course, if anything breaks related to the budget, we'll be. So if there are no other announcements, then I will go and take this opportunity to adjourn us. Thank you again to our wonderful presenters for all the great information. We will be sharing the recording, and we encourage you all to share that with your network.
I think we just lost Adam, but anyway, great job, Adam. Sorry your internet clunked out, and thanks everybody for being here. We'll send you the video follow-up. Really appreciate your questions, appreciate our presenters, and we will hopefully see you next Friday. Watch your inbox for the written update. Take care, everybody.